Hi, I'm Chris. I'm here to talk about lesions and MRI. In the very early days, people didn't know the different parts of the brain are responsible for different psychological functions. In fact, people had thought it may just be one lump of stuff, a bit like other organs such as the liver, which also isn't functionally divided into dozens of spatially organized units. Damaging parts of it will compromise its overall function, but not specifically to one function only, depending on the location of the damage. But the French physician Paul Broca in the 19th century studied patients with some very specific deficits. One such patient was called Tan, because when asked what his name was, he said Tan. When asked how old he was, he said Tan. When asked where he lived, he also said Tan. So basically, he was only able to say that one syllable. Turns out that patient had a fairly localized damage to the left frontal lobe. They found out the problem only after the patient died, when they took his brain out from the skull to examine it. This led to the term Broca's area, which refers to the region in the left frontal cortex responsible for language production. Interestingly, language comprehension is somewhat spared in patients with damage to Broca's area. For patients who can't understand spoken language anymore, it usually involves damage to the left temporal lobe, so the mapping between function and brain damage seems fairly tight. But Broca's patient Tan was an exceptional case. Many other patients often come with deficits that weren't so specific. In part, that was because these brain lesions were large. They may happen because of a stroke or a traumatic brain injury, TBI. In modern times, quantifying the exact location of these lesions became easier because of the use of brain imaging technology. There are many kinds of brain scans one could do, but one common method used in research is magnetic resonance imaging, MRI. Doctors use it too, to detect brain tumors. It can also be used for other body parts, like when you're checking for small bone fractures or accumulation of fluids. How does an MRI work? Well, it involves fairly complicated physics that's beyond the scope of this class. But roughly, we know that the magnetic properties of the different molecules in bodily tissues differ. That is, for example, water and fat molecules react differently when they are placed within a very strong magnetic field. The difference, though tiny, can be detected in MRI. Because different bodily tissues have different water and fat content, by focusing on the contrast between them, we produce images like this. Roughly, taking a picture like these take anything between a few minutes to a half an hour, and will cost around a few hundred US. The quality of the image depends on many factors. One, which is the static magnetic strength of the scanner, measured in standard physics units, Tesla. Many current research scanners are at 3T. Now then, water and fat are common in bodily tissues, but there are other things MRI can be used to focus on, which is why we have functional MRI, also known as fMRI.